Dylan Roskam-Edris is the Open Science Alliance Officer for the Tannenbaum Open Science Institute at McGill University. McGill University and its Montreal Neurological Institute Hospital, also known as Neuro, have for years pursued open science principles in how they work with their research as well as in their external research partnerships. And Dylan's work is focused on promoting the uptake of open science tools and practices in Canadian neuroscience research. So Dylan, the word is yours.
Let's hope I can treat it well. Hello, yes. Thank you very much for inviting me to your beautiful country. I've been enjoying Denmark very much. Haven't seen very much of it, but I'm going to spend a week after this exploring. So if any of you have any recommendations, please come my way. All right, so as I was introduced, Dylan Roskam-Edris, my background is in neuroscience, health ethics, and intellectual property. I didn't know open science was going to happen, but then it did happen, and it was like, I was just waiting for it. First things first, however, let's get this out of the way. By continuing to listen to this talk, you agree to the following. Any and all intellectual property, real or potential, and subject to recognized by any jurisdiction, existing prior to this talk or contained therein is hereby claimed by the originating party, and any intellectual property arising out of the combination, remixing, modification, adaptation, or other alteration of existing intellectual property may not be used for any purpose other than by written consent received by facsimile or registered carrier. Take a second to consider that statement. I think we can all agree about a couple of descriptors: complicated, cumbersome, unnecessary. The one I like most is ridiculous. And yet it's exactly the kind of language that and I imagine at least some of the folks in this room, have to bang our heads against on a weekly, sometimes daily basis. I have researchers email me pages of clauses like this and tell me that they need to sign it before they're allowed to start a new project, whether with another collaborating academic institution or with industry, or they have to sign something like that before they can access data or obtain a plasmid or a cell line or buy a piece of instrumentation or install a piece of software. These are incredibly smart people who just want to understand how the brain works and extend human knowledge to help patients. They want to have, and they have access, or at least they should have access, to more access faster to better tools than any time in human history. And yet they send me something like this, and then they have to wait days or weeks, sometimes months, for interpretation, haggling, figuring things out between one party and the next party. And then if something does get discovered, they have to wait until the patent is filed, and then they have to wait until there's a complicated licensing agreement for something that 90+%, nothing ever happens. This is wasting all of our time. I want you to keep these things in mind when I ask the following question in a couple of different ways over this talk. Is this really necessary? In a world where information can effectively be infinitely transmittable and malleable and usable and remixable, where high-quality scientific tools are available either to be made in the lab based on tutorial videos that you can download on YouTube, or at least within a day's transit, a day's carrier mail, is it really necessary for us to have those cumbersome legal agreements? In all seriousness, I'm releasing this talk under a Creative Commons attribution-only license. You can access it either by using that URL or checking out the QR code. This means as long as you give me a reference, anyone and everyone has my permission, you don't have to ask it, to use it for anything you like. You can use it for profit if you can find a reason to, and if you do, please let me know. You don't need to ask my permission. I wish you the best of luck. Why am I using this open license? It's worth asking the question. Because I know that by making useful material, sharing it widely with minimal restrictions, I make my chosen area of interest, open science, better. I'm contributing to an abundance of tools which benefits the work of others, which benefits the field, which benefits me. This is the story that we're creating with open science. And as just a little aside, the QR code, which you use to get in, which is right there, which you see all over the place, it's an open standard. The people who invented it didn't patent it. And now you see it absolutely all over the place. Thanks Denso Wave for applying it originally in car manufacturing and then deciding to open it. And now it's used all over the world for almost anything you can imagine. Whatever field you're in, I'm banking that your goal is to bring benefit to humanity. And you'd probably agree that we should use the best means at our disposal to find creative and effective ways of doing so. I think we can also agree that our ability to find creative and effective solutions depends entirely on having the information and the tools you need to capitalize on that information. And when it comes to scientific work, the primary tools, the grist for the creative mill, is information from research and the tools that were used in doing that research. The capacity to share information rapidly and globally and to produce high-quality, low-cost tools is the single greatest boon to the creative scientific activity that we've ever seen, and the easier it is to access, the easier it is to share, and the easier it is to use, the better. I think we can also agree that having to wade through the kind of statement that I jokingly started this talk off with, or better yet, paying an IP lawyer somewhere in the range of $300 to $500 to interpret it for you, is a significant barrier. So why do we do it? Why do researchers, administrators, entrepreneurs, innovators, citizen scientists, policymakers, funders, and everyone else for whom scientific information is an important tool and input put up with it? The reason that I'd like to highlight in this talk, there are many reasons, but the reason that I want to talk about the most is that we're stuck in a psychology of scarcity. The idea is that the tools of science are necessarily rare, expensive, difficult to make, difficult to access, and difficult to use. That's not an entirely unreasonable position. For a long time, especially in biomedical research, it has been a scarcity game. Information and tools were hard to come by and quite often very expensive. For most of history, since the first publication of the Philosophical Transactions of the Royal Society, you can see the cover of it right there. I got that off of Wikimedia, by the way. Public domain license means I don't even have to reference it. Unless you were reading the right journal or a member of the right society, it was nigh impossible to know that a new tool existed or where to find a new piece of knowledge. Under these conditions, making new discoveries and building on old knowledge was really, really tough. For just a couple of examples, the treatment of scurvy took 50 years between the first controlled experiment of it and actually putting it into practice. That's about 20,000 sailors died during that time. Penicillin took 15 years from the first paper that was Fleming published to a first real trial. And the only reason it was that fast was because World War II needed it. If you want to learn more about the history of cell lines, check out The Immortal Life of Henrietta Lacks. Was rare. All of a sudden, something was discovered, unfortunately patented, and then put out. The patenting made it expensive. The trend that we've seen since at least the end of World War II, and this is why we're doing it, is that the attempts to solve this dissemination problem are based on strategies from within a scarcity mindset. Here are two examples of that scarcity mindset. We've got things like the Bayh-Dole Act, which if you don't know about, it's about encouraging institutions in the United States to patent their inventions and then try to license them to industry. The idea being that you should patent, that will transfer it into the market, and then the market will do the work of distributing it. Another great example is the open access movement right now is dealing with the old traditional model of distributing scientific information through journals. The only reason that worked was because of copyright, another branch of intellectual property that allowed the transfer from the scientist to the company or to a publisher, and then the publisher to capitalize on that intellectual property to transfer it around the world. Now, it was in fact true that we needed to be able to transmit results. And given the cutting edge technology of much of scientific history, mainly the journal and in-person conferences, it did seem like we needed a better mechanism for moving knowledge from the ivory tower out into the world. Applying a scarcity strategy, which, to put it in a nutshell, is basically use IP to turn information into property, put a price on it, and then sell it. The delays and the headaches and the types of clauses that I started this off with were seen as a reasonable balance within the market. As this scarcity-based model collides with the world that includes the ability to transfer information nearly instantly and at low cost, the trade-off is looking less and less acceptable. We chafe against high profit margins for publishers and expensive drugs in a world where that doesn't necessarily have to exist. It's no coincidence and should come as no surprise that the collision of that old world with the new has led to the open science movement. It's trite within open science to say that there are many definitions and many different concepts that are related to open science, and this is true. There are lots of different words and definitions you can use to describe it. There's no consensus on what makes open science real open science. Putting aside the project of trying to solve that definitional problem in the half-hour talk, I want to talk about the concept of abundance, as contrasted with scarcity, and explore why it's important for the future of science, why it's going to accelerate innovation within neuroscience as well as outside of it, why it's important for companies to recognize that science is turning into an abundant innovation environment. I like the term abundance because it has an intuitive meaning. When something is easy to access and easy to use, you have an abundant innovation environment. When the tools are easy to access and easy to use. When they're not, you have a scarce environment. Right now, what we're seeing and what open science is helping with is moving science as a whole from that scarcity environment into an abundant environment. That's going to be the primary driver of acceleration. Every time someone publishes an open access paper, every time someone shares data, every time someone shares a new software tool or a new hardware design under an open license, every time someone shares reagents without patenting, thank you, Al, or shares instructions on YouTube for how to do a particular experiment, run a particular protocol, they help make each element of science more abundant. And it is this abundance that will be the primary driver of accelerating research, discovery, and innovation in the future. That's the acceleration we're talking about. For those familiar with the history of open source software, this is going to come as no surprise. I'm sorry if you are familiar with it, and I'm putting any of you to sleep. The fact of the matter is that today, every single company relies on open source software, meaning software that can be freely accessed, modified, and used for any purpose. They're all every single one incorporates it into its operations. I'm not just talking about software companies, though Facebook and Google and Apple and Microsoft would not be what they are today without access to those abundant resources. Any company that uses a WordPress website, uses the Firefox web browser, uses Android phones, or uses a Wi-Fi router, the Wi-Fi router that you're connected to right now almost certainly runs an open source operating system. You have no choice if you're in business but to work within the open innovation and abundant research environment. And why? Because if a software engineer has the choice between writing a piece of code and Googling a piece of open source code and that does exactly the same thing and pasting it into their use, take one guess which way they're going to go with that. As this starts to happen with reagents, with antibodies, with data, the same decision is going to be made. This is how every single time you share whatever comes out of your research, you're creating this abundant research environment. What's exciting is that it's making it into everywhere in science now. So let's start talking about neuroscience. We'll get away from the background. Let's look at a couple of different ways and in a couple of different places that it's happening throughout the field of neuroscience and how you, whether you're in the public practice or private or whatever, can participate and derive value from it. Let's start with the open science at the Neuro. It doesn't look like that yet, but very soon. The Neuro is a research and teaching hospital founded in 1934 by Wilder Penfield. If you've heard of him, you've probably heard of the homunculus. Unfortunately, in Canada, I usually have a nice little vignette about Canadian heritage moments, which are these little 30-second, look how cool Canada is that they used to put on public broadcasting, but I'm banking those are not broadcast in Denmark. In 2016, it declared itself an open science institute and founded the Tannenbaum Open Science Institute, the folks I work with. We have a bunch of principles that inform the way that we do open science and the way that we define it. In this talk, I want to concentrate on two. I want to concentrate on two of the pillar platforms that we use, the Clinical Biospecimen Imaging and Genetics Repository. If you don't want the whole mouthful, you can see CBIG, you can call it CBIG, and the Early Drug Discovery Unit, the EDDU. I could talk about these all day, but let's concentrate on looking at it through the lens of abundance. First, CBIG. When you're a hospital studying and treating neurological disorders, There's a serious natural scarcity. The capacity for patients to be examined, to participate in research, it's highly limited. There's only so many days they can spend in a building. There's only so many healthcare professionals that can be involved in their circle of care. And there's only so many people who can run the scanners. There's only so many people within an institute who can analyze the scans, publish papers. What CBIGS does is to take the patient population and generate a variety of different data sets, genetic, clinical, behavioral, imaging, and create a rich, multi-layered digital representation of those patients stored in CBIG that is then shared with the rest of the world. In doing so, you've taken a naturally scarce resource and turned it into an abundant resource. By doing so, the potential community that can be engaged in treatment and research increases by orders of magnitude. It's turned a naturally scarce resource into an abundant one. Now, there are risks with this kind of endeavor, largely has to do with patient privacy. This is why CBIG uses de-identification and a tiered access model as a way of creating this abundance while minimizing risks. Please, if you want to ask questions about any of these numbers or Loris or the ethics framework and how it was designed, I'm happy to do so at the end or in the panel later. CBIG works and collaborates with academia and industry in a number of different ways. The first is simply that any of them are allowed to use it. Please go in, register if you have to get registered access data, or if you need controlled access data, we'll try to turn it around as quickly as possible. The idea is that as long as you check the boxes of not trying to get IP that will interfere with the future sharing of information and protect patient privacy, take it away. The idea is to get it to as many people's hands as we possibly can, because the more eyeballs is going to make that new insight that might change a patient's life. Another way is more active. It takes the shape of an open science partnership, the type of thing that the SGC engages in. Companies will come in and collaborate or sponsor research to be able to expand the number of patients that are contained within CBIG. You can go from, we already have a good Parkinson's disease contingent. Let's say you want to look at ALS. Let's say you want to look at neuromuscular disease, brain cancer. You can come in and work. And by doing so, you enable us to create this abundant resource that the rest of the world can use and that you probably have a particular interest in. That's why you sponsored it in the first place. So that's broadening the representation. The other way is deepening the representation, so adding different varieties of data, so different data modalities. Right now, I'm working on a project with the Target ALS, funded by Target ALS and the Capture ALS initiative, that's trying to factor in gait analysis. So they use wearable insoles that can be, used throughout the patient's normal walking day as a way of indicating what potential gait changes lead to an increase in symptoms. The EDDU is a complementary effort. Working with CBIG, they take some of the tissue samples that are collected from patients and use them to generate induced pluripotent stem cell lines and neural organoids. This is another example of taking a naturally scarce resource, namely biological samples, and turning them into an infinitely renewable resource that can be shared throughout the world. And none of it is covered by patents. There are as few IP restrictions as possible. More abundance, more opportunity for more people to work with this once a rare resource. That is an abundant innovation environment, and that is the thing that is going to let us find that new idea, that new change, that new insight that's going to lead to a cure. Because in neurodegenerative diseases, cures are hard to come by and very much needed. There are a couple of different ways that the EDDU works with industry. They collaboratively develop protocols and then share them, also on Zenodo. A lot of this comes from Al. He is, in fact, a pioneer. They create new cell lines and share them. They do drug screenings, and they distribute these cell lines through CBIG, which you can get if you're industry, you want to use them as a drug screen. But the EDDU doesn't stop there. Remember when I said that abundance requires ease of use. Ease of use isn't just being able to have access to something, it's being enabled to use it. What they've also been doing is creating video protocols. So all of the different protocols that they have, there's a video tutorial. You can go on YouTube right now and look at it. It's been translated into 4 different languages. This doesn't just remove barriers, it creates capacity within potential collaborators. Once again, increasing the number of people who can generate an insight. Oh, I'll pause there because I forgot to change the slide. So we'll give you just 5 seconds to be able to quickly go through. Please do check out the ETDU's data access portal. If you go to the Neuros website, you'll be able to access it. So these efforts are great, but they're only a small corner of what's possible. By taking that patient population and making it abundant, that's fantastic. But there are so many different components of research and of the innovation lifecycle, going from the data that you're generating, the software you're using to acquire it, the hardware that you're using in order to look inside of a mouse's brain, or study the EEG readings when a patient is undergoing some type of behavioral test. A lot of this is extremely expensive. Let's start looking at some of the other elements within open science where people are creating abundance. Some of these the neuro is involved with, some of it's just super cool, so I wanted to draw your attention. First, let's look at instrumentation and hardware. Those 2 on the left, the Mesospim and the Miniscope, are 2 recipients of the Neuro, Irv, and Helga Cooper Foundation Open Science Prize, which is a prize for open science and neuroscience that COSI runs. They're both different varieties of open hardware microscope. The Miniscope, which won 2 years ago, is now used widely throughout the world and costs less than 25% of the proprietary commercial competing product. It's all open. You can download the parts list right now, order the parts yourself. You can go on to OpenEphys or on the Miniscope website, order a whole bunch of different parts and assemble it yourself. You can also order the whole thing, and all for the significantly reduced cost. Mesospim is a little bit more, I encourage you to check it out. Mesospim is also within the instrumentation and microscopy environment, but more towards looking at clarified tissues. Some of the ones that we're not involved with, but what you should have a look at, is OpenBCI. I realize now that I should have used a symbol with the actual name on it, but the gear with the brain in the middle, OpenBCI. They're creating open source EEG and virtual reality headsets. OpenEphys has a whole bunch of open hardware for electrophysiology research, whether you're talking about modulators, control panels, probes. And OpenTrons is one of my favorite. This isn't just within the neuroscience domain. It's basically, they create a pipetting robot that you can program, all based on open source code. One of the greatest stories about them is over the course of the pandemic, they were able to rapidly deploy or work with companies to rapidly deploy testing that could test 50,000 people a day within a couple of months. They worked with OpenCell and they worked with the Pandemic Response Lab. They're also about 25% of the cost of competing products, and I could go on about them all day as well. I've seen open innovation with them, community-based open innovation happen on Twitter, where there was a user who was using OpenTrons. They needed a QR code scanner. So someone just built one out of parts, posted it on Twitter, sends the part list off to OpenTrons, and now OpenTrons can incorporate that into their next design. No licensing agreement required. It was just a community who could use this new functionality and then incorporate it into a product that could then help others. Let's look at a couple more. It's also happening in software. So the ones on the left-hand side, left-hand side. The Enigma Toolbox was also a recipient of the Open Science Prize. Brainstorm and Pineapple have received funding from COSI. And they're competing with the other existing proprietary tools that are now slowly being phased out all the way across the field. Another one of my favorites is Deep Lab Cut. This is for pose estimation and for just tracking the movements of animals in an automatic way. It's not just useful for neuroscience research, but it's being used in hundreds of papers now. Unless I'm running out of time, so I'll try to speed it up. Al already talked about Icaros. This is happening at one of the labs at the Neuro. One of the things I like about this is that I talked about abundance. It's great to have an abundance of information, but if you have an abundance of garbage information, you're not going to help you're not going to help anybody. So we need platforms, tools, companies that are applying the computer science maxim of garbage in, garbage out. We need to reduce the amount of garbage in so that we can reduce the amount of garbage out, make an abundance of useful tools. Another thing to pay attention to is open communities. This isn't directly in the IP department, but I can't talk about open science without talking about communities. White matter rounds and the one below it have also been funded by TOSI. They are all about trying to bring together people from all over the world to participate in diagnosis and research. Please look up the rest of these as well. Another one of the coolest is Just One Giant Lab that's trying to break down the walls of collaboration. I sometimes have a difficult task of convincing folks in industry and, to be honest, a lot of folks in academia to participate in these types of endeavors. A big part of the reason is that those who have come up on the stories of the tragedy of the commons, the academic credit economy, the boundaries of the firm, the attempt to internalize positive externalities to confer benefit on competitors are deep in a scarcity mindset. But the areas of abundance are multiplying and growing. As I hope I've demonstrated in some of the examples of this talk, which are only a small portion of the total activity that's occurring within neuroscience and within science as a whole, open science is turning science from a scarcity into an abundance game. The same way that open source tools have taken over software, open science tools are going to be taking over science. And not because of some starry-eyed save the world sentiment, though there's nothing wrong with that, but because in the age of acceleration and rapid progress, the ease of access and the ease of use are both possible and vital, and old models are just slowing that down. The real question is not whether being involved in creating abundance is something that you maybe should engage in. The question you have to ask yourself is, if someone has a choice between a creaky old legacy system that takes a long time to set up and use, or an open tool that gets the job done, which one are they going to choose? They're going to choose the open tool. If you don't accept that, the companies that don't do it, the academics that don't do it, the institutions that don't do it, they're going to be the equivalent of the vaudeville performers who couldn't make the jump to radio. New technologies create new possibilities for political and social change. You need to accept that and move along with it. So to start thinking about it, ask yourself two questions. How can I create abundance in areas that I have interest in, or if you're industry where I have competitive advantage? Maybe you have some kind of existing in-house knowledge, some specific tools, some proprietary tools that are going to be able to, you're going to be able to launch into an actual product. Rather, how do I get involved in the diverse communities that are currently producing abundant resources within the innovation environment that concerns me? There are hundreds of different ways you can do it. Maybe it's setting up some kind of open source partnership with CBIG or with the EDDU or with the SGC or any of the communities that are working within your area of interest. That's what Takeda has been doing with CBIG and the EDDU for a long time. Roche is getting into it too. Just look up the neurogenomics partnership if you want an example. Maybe it's starting to use open science software or open source software or open science instrumentation within your methods, within the work that you do within your company or within your collaborations. Maybe it's trying to figure out how to make academic open source and scientific open source sustainable. That's a big problem within science right now, the ability to make this open source package that is being maintained by one postdoc in Ohio, but is fundamental to the work of hundreds of different scientists around the world. You can contribute your business advice, contribute money, or engage in some kind of managed open source arrangement. You can ask me about that later, or look up TideLift. Then please hop on it right now. Maybe it's as simple as doing a resource and software audit and seeing the open tools that you already use, seeing the way that it confers benefit on your company or your lab. As soon as you modify your thinking to go beyond a scarcity mindset and go into an abundance mindset, there are endless possibilities, and you're going to be more ready for the future than the dinosaurs that don't. Thanks.